Good morning, everyone, and welcome to Coffee Talk. This is our second in a series where we offer you a chance to look inside the Maryland Food Bank, a little inside baseball, because really without you, our donors, our supporters, our volunteers by our side, we certainly could not do the work we do. Our hope for today's webinar is to give you direct access to our team so you can learn more about how our organization makes thoughtful and strategic decisions, all aligned around improving outcomes for people facing hunger in Maryland. For those of you who don't know me, my name is Carmen Guercio, and I'm President and CEO of the Maryland Food Bank, and I'm going to be your host today. I'm going to be helped by a lot of people behind the scenes, but in particular, Elise Krickow, our Senior VP of Development, who will be capturing your questions and comments so you can fully engage in this presentation that I'm really excited about. In our time together today, we're going to take a deeper dive into how we're using data to both inform and refine our programming. But before we get into that, I do want to take a few minutes to give you a quick update on our efforts over the last year to strengthen communities all across our state. I think it's safe to say that the pandemic is lessening its grip on our food bank, but it does not mean our challenges are any less. We're still feeling the impact of a need that exceeded pre-COVID levels, and now, like many of you, we're also having to manage rapidly rising costs of utilities, gas, and especially food. This inflation environment has put tremendous pressure on families all across our state. If you just do the math, an 8% inflation rate means an average family is now paying over $300 more a month for goods and services. So just imagine how that impact has on working families who in this expensive state were already struggling to make ends meet. Now we have even more people having to make difficult choices when it comes to expenses. Food or rent, food or transportation, healthcare. We continue to feel the effects of this economy on our work, and we will continue to do so for some time to come. But there is a silver lining. The silver lining is the high levels of public and private support we received and are continuing to receive that are allowing us to buy food at record levels in unprecedented costs. Just as a quick reference, pre-pandemic, we bought about 12 million pounds of food at about 45 cents a pound. Today, we're buying 25 million pounds of food at about 90 cents a pound. That's twice the amount of food we're buying at twice the cost, for about a $17 million impact in food costs alone. That's not taking into account the cost of fuel, cardboard, and other challenges we're facing. But thanks to your support, we've been able to distribute all that purchased food at no cost to our partners for the last 2 years, and we expect to be able to continue to do that, providing that incredible benefit to our partners throughout the rest of this of calendar year 22. Maryland Food Bank's vision to end hunger is felt across the state as we distributed enough food to provide the equivalent of 62 million meals over the course of 2021. That's 170,000 meals each and every day of the year. We're also a highly efficient organization with 92% of our resources going directly to program services. So what are we doing now? We're starting to look towards the future. We recently refreshed our strategic plan, incorporating our learnings during COVID, become an even more impactful organization by expanding access to nutritious food, providing more pathways out of hunger for Marylanders, and strengthening both our own organization as well as the communities we serve. And I'm proud to report we're making strong progress on our plan, which we call MFB 3.0. We've introduced new programs like mobile markets that you'll hear a little bit more about today from my colleagues, allowing us to reach hard-to-reach communities. We've customized our food boxes to make sure that they're healthy and they're culturally preferred, so we can also reach homebound individuals. We're also increasing nutritional content of all the food we distribute each and every day. We've expanded our own workforce development program, our culinary training program called FoodWorks. We now have facilities here in Baltimore City as well as the Eastern Shore. And we're also partnering with other workforce development organizations to provide food assistance to their participants so they can increase their participation and improve their attrition rates. Internally, we've also embarked on a DEI journey. We started about a year ago to increase awareness and dialogue across every level of our organization so we can apply a more equitable approach and an equitable lens to everything we do, both inside and outside the four walls of the food bank. Again, we're excited about the journey we're on to build an even more effective, impactful food bank and really have you to thank for helping us along that path. So thank you for the opportunity to give you a quick update. And I want to turn to the reason that we're all here. I have the good fortune to be joined here by three amazing team members from our programs team. And I'll start by introducing Nekeisia Booyer. Nekeisia has just recently been elevated to Chief Programs Officer. Congratulations. After 2 very successful years leading our programs through the teeth of the pandemic. She joined us just as the pandemic began, and the fact that she's sitting here today and moving to an even broader leadership role is a testament to her tenacity, her vision, and her commitment. Nekeisia brings significant experience to the Maryland Food Bank, including roles where she worked directly with people living in poverty. She has a clear understanding of what is needed to help people facing hardship successfully stabilize and thrive, so that she has also deep experience with workforce training programs, which we'll be integrating more fully into our work over the next 12 to 18 months. Also joined by 2 other people who recently have also been promoted as part of our efforts to continue to align our resources and strengthen our team. Emily Alt and Jennifer Small are now vice presidents for our programs team. Emily leads a very talented regional programs team, making sure our priorities, our food resources, and our strategies are fully aligned. A job that is certainly takes continuous attention, Emily. Emily and her team connect and coordinate our partner agencies locally so that individuals and families can turn to help with local organizations they know and trust. But in turn, those same organizations can tap into best practices and learn from other entities in our vast statewide network. Emily also sets strategy for our school pantry and pantry on the go programs, ensuring that all our tools are being leveraged to their fullest. We're also joined by Jennifer Small, who's been a key contributor to the Maryland Food Bank's work for a dozen years now. Jennifer has done incredible work to strengthen the food assistance network in 8 counties of the Eastern Shore over that time, as well as bring food assistance programs into alignment statewide. In her new role, Jennifer will be managing the intersection of our program strategy and our many, many resources, including food, events, public programs, mobile markets, and anything else that we can fit into that job description between now and the end of this call. I want to thank all 3 of you for joining us today and for the incredible work you've all done, especially during the last couple of years, to help the Maryland Food Bank navigate what has been the most dramatic spike in need in our state has ever experienced. So thank you. So now I want to shift gears to some of the questions I know that all of you, our viewers, are interested in. I'm going to start kind of on us and just a quick temperature check, if you will. You've all been with us now for a few years, and Jennifer, you maybe a little bit longer, so maybe a different perspective. But what is it about the Maryland Food Bank, right, that excites you about right now? Maybe Nekeisia, would I start with you?
Sure.
Can I start with you?
Well, Carmen, one of the most exciting things about MFB for me right now is integrating our Food Works culinary training and prepared meals programs under our community impact team. And that team provides wraparound services to our food insecure Marylanders. So as you mentioned during my introduction, this integration will take over the next year and a half, Carmen. So during this time, we'll be assessing and aligning the teams in a way that positions us to have a greater collective impact. So I'm looking forward to establishing a more streamlined approach to addressing food and financial insecurities for all of our neighbors and to help strengthen communities through this integration. So I'm excited and ready to go.
A +1 on that one for sure. Emily, how about you?
I'm really excited about the strength and resilience of our partners. They've done more than any of us realized was possible over the past few years. And due to the Maryland Food Bank's support and resources, our partnership is even stronger than ever before. And our shared impact has really been incredible.
Yeah, absolutely. Thank you. Jennifer?
There are so many things that I'm excited about. So many things bring me great pride, having worked with the Maryland Food Bank for so long. What excites me the most centers around our evolution of the Maryland Food Bank over that time, our expanded footprint across the state, which is built upon strategy and intentionality to do more for our neighbors in need, a footprint that's built upon community partnerships and education and advocacy. I'm most excited about our ability to pivot quickly, to learn, to build solutions that helped us to serve thousands of Marylanders during a global pandemic. And I'm really excited about the future of our work.
Yeah, thank you. It's funny, pivot's a word that probably didn't exist 2 years ago. And since the pandemic, we talk about it all the time, but it was incredibly important. Emily, obviously during the pandemic, we were all hands on deck. Demand went through the roof literally overnight. You were relatively new to the organization. You didn't have a huge perspective on what food banking looked like, but what are some of the high impact activities and changes that you saw, even though you were only here a short time prior to the pandemic?
Yeah, some of the changes I saw include better communication with our partners, learning to convene virtually, which we all had to learn how to do, provide regular support in new ways. We held webinars, virtual trainings, meetings, convenings, We even rolled out a new intranet portal for better communication with our partners. During that time, we brought on an incredible number of new partners and expanded programming in areas of unmet need. We brought on over 100 new and expanded partnerships since last July alone. We were able to provide resources to our partners to help them stay open and continue supporting their communities, supporting the rising costs of food, plus providing them with funds to improve their infrastructure and capacity to do even more.
Yeah, I think as pandemic is lightened and all of us are getting out and about more, talking to our partners, I mean, that's one thing I think I hear constantly in terms of our ability to kind of provide some backstop and level support during the pandemic was critical to their success and was critical to the work we did. So Jennifer, I'm going to take a little different twist on that question because again, you have a little more history here, but what are some of the changes that you've seen that you'd like to see us continue to maintain in terms of our model going forward?
Well, so many changes. I mean, with the onset of COVID, many things changed. Of great importance was our ability to directly integrate our programming into areas of high need. It allowed us to support variable needs of neighbors in both underserved but our unserved areas in a much more holistic way. So we created the mobile market, something I'm very proud about. And that initiative was developed to improve access, build stronger support systems by serving as Maryland's food assistance safety net. And our emphasis was on healthy, nutritious foods. Through the mobile market, we're also able to address geographic challenges and local level community needs, things such as lack of transportation, so that we're helping to solve for regionally defined root causes of food insecurity, offering alternate pathways out of hunger or wraparound services you'll hear a little bit later about. Not only breaking the cycles of poverty, but shortening the line and being able to move people out of hunger.
I might be showing my age, but I was describing what a mobile market was to somebody the other day, and I use the term a bookmobile for food. So I'm not sure if many folks remember what a bookmobile was, but I think hopefully that's a decent description. But we have 2 vehicles now, right?
We do.
And one coming.
And one coming.
Good. So it's coming soon to a community near you. Nekeisia, I'm going to zoom out a little bit. Obviously, you know, in your role here in terms of where you sit and the fact that the 2 years you've been here, what are some things that some highlights you want to reference that you've seen over the last 2 years of your time here?
Most definitely, Carmen. I think for one, what was really pivotal was the reorganization of our programs into geographically focused regions. It gave our staff a way to really understand and manage our local program partners. The pressure testing of this new approach, it happened right as I arrived. So in hindsight, this regional model that launched in 2018, it was a critical ingredient that allowed us to be as effective as we were during the pandemic. So because of the regional model, our staff knew our partners, and we were able to keep nearly 80% of our network sites open. And when more food or funds were needed locally, we were able to equitably distribute those resources. So that is why the state turned to us in such a big way at the time that they did. So another success that I am very proud of is the degree to which we have increased the nutritional quality and the cultural diversity of the food we purchase and grow. So during this pandemic, you know, thanks to the outpouring of our financial support from our supporters, we were able to purchase more food than at any time in our history. And we know that the more that we can do to provide food that is culturally familiar, that is fresh, and even medically tailored, the more progress we will see in areas like improved health outcomes and even academic success for our children and the young adults that we serve. Finally, we were very keen on using technology and data to inform our work. So Emily, would you share how the regional team is using our updated Maryland hunger map?
Absolutely. Yeah. At a very high level, this ArcGIS map shows how the Maryland Food Bank's food distribution programs compare to levels of need. There's a lot more detail behind each of these categories, but in short, this map allows us to look at where we are distributing food and how much, and compare that to different ways to examine need. We look at US Census Pulse survey data. We look at the United Way's ALICE survival budget, which is a much better measure of need than the federal poverty level. We also look at other hardship measures like jobless claims and housing instability. This tool allows us to see quantitative data showing where there is unmet need, and then our programs team digs deeper to really understand the stories and realities that each community is facing to help us determine where more Maryland Food Bank services are needed. For example, many communities do not have grocery stores. And since many Marylanders cannot get to stores and or cannot afford the cost of fresh produce or healthy proteins like poultry or fish, we are creating strategies to ensure access to nutritious food in these hunger hotspots.
Yeah, I mean, clearly capturing all those data points just talks about the fact that how complicated food insecurity is and what the driving factors. And so this marriage of both qualitative and quantitative data, I think is really going to be highly effective for us, already has been highly effective for us in terms of our programmatic response, and will be going forward as well. You know, data became an important focus for us in our MFB 2.0 strategic plan. And as we refresh our plan, we realize it's becoming even more important for us to be a more data-driven organization. So Nekeisia, can you talk a little bit about how you're utilizing data to focus on food quality? And I know also that you're doing more with Maryland growers, farmers and producers. And so why is that important?
Well, first and foremost, Carmen, everyone deserves to have access to healthy, nutritious food. And for communities that don't have that available, or for individuals or families that can't afford to purchase nutritious food, the negative impacts are very serious. There's diet-related diseases like hypertension and diabetes. They become, chronic health conditions. And our kids, they need balanced nutrition to learn and grow. And often they rely on school meal programs. And our seniors, that we also refer to as our older adults, they also need good quality food, especially since many of them are homebound. So to answer this question aligns with our MFB, with us being part of a more equitable, resilient, and accessible food system for all Marylanders. Unfortunately, neither our nation nor other states, they have food systems that are designed to grow and distribute nutritious food that everyone can afford. But we think that Maryland, that we're in a perfect place for us to make an impactful change against what is a national challenge.
Well, I thank you, referencing our North Star with regard to an equitable, resilient, and accessible food system. Maybe Jennifer, I'll turn to you as someone who has a little more experience in this field than the three of us. What does that look like and why is it important?
Carmen, that's a great question. Very early on in the pandemic, we can all relate to the experience that we faced with empty shelves in our grocery stores. This is when we got a crash course in what the supply chain looked like. Over the past 100 years or so, our nation has moved away from local agriculture towards a more global model. And now most of our foods are coming from producers that are out of state or across the country. One of the negative byproducts of that is that we're no longer controlling our own food production, meaning that we're not growing the food that we eat. Our farmers are losing income, costs continue to rise. An equitable, resilient, and accessible food system incentivizes local ownership of food production. And in turn, our distribution routes will get smaller, food will be fresh and affordable, and even the environment benefits from that. An equitable, resilient, and accessible food system is a system that's feeding us all, from growing to processing, packaging, distributing, to eating and even disposing of food. And even though we're talking about several things here today, we're largely focused on the fact that not everyone in our state has equal nor equitable access to nutritious food.
Keisha, anything you would add to that?
Yeah, several things, Carmen, actually. We've accomplished quite a bit during the past 2 years, and there's still much to be done. But thanks to the outpouring of our financial support from our donors and partners, and via the work of our volunteers, we can implement strategic initiatives. So how are we putting those philanthropic funds to work creating change in the Maryland's food system? Well, first, here's just a few examples of that. We're expanding our farm to food bank program by doubling its size over the next 18 months, from about 1 million pounds of food harvested annually to over 2 million pounds. So including distributing other fresh local Maryland foods like fish and poultry and dairy products. We're also expanding strategic food distribution methods, such as our mobile markets, our Pantry on the Go program, and our BUBs. And BUBs are, of course, but for our viewers, they're backup boxes, and they're comprised of shelf-stable foods that are low in sugar and sodium and saturated fats. And they can easily be transported and distributed quickly across the state. So we're increasing the capacity of our local organizations to distribute nutritious foods by doubling our grant making next year, distributing $2 million in funds to community-based organizations to expand their food distribution with an emphasis on healthy, nutritious foods. We're also exploring the creation of super pantries, which provide both access to healthy food and wraparound services to neighbors by having a one-stop shop to access both food and other resources like housing and transportation assistance. So we know that financial security is a root cause of food insecurity, and it's a barrier to affording healthy foods. And we are supporting economic mobility through our workforce development programs, such as our own MFB FoodWorks Culinary Training Program. And we have a new pilot program, and it's designed to connect young Baltimore City residents with training programs that lead to jobs in high growth industries such as IT and healthcare. And finally, Carmen, MFB has become more active in impacting policy change. We have already successfully supported new legislation to expand effective anti-hunger programs like our SNAP and school meals program. So as I stated, we've done a lot and there's just so much more to do.
I appreciate that summary. I mean, when you hear someone talk about all the activity going on with the organization, you realize that, again, we're taking a multi-pronged approach to a very complex issue.
Absolutely.
And so thank you for sharing with that. I think really this might be a good time, if I could, I might just stop the program here and maybe turn to Elise to see if we have any questions from our viewers and that we can follow up on. So Elise, anything coming in from the chat?
Yeah, thanks, Carmen. Well, we basically have some questions about some priority areas. So maybe Emily, you could answer that question. It is around how do we address the priority areas? How are we getting out there and using the data from the hunger map to address these areas? And how do you determine that it's a priority area?
Yeah, sure. Well, I'm really glad that we were able to share that tool that we use, the Maryland Hunger Map. It is one of the tools that my team uses to identify priority areas. And when we say a priority area, we mean it's really an area where the food that we're distributing isn't quite meeting the need that we know is there for a variety of reasons. There could be priority populations there, which are populations who are disproportionately impacted by food insecurity. And we want to make sure that we are addressing those areas with the right programming. So we have a variety of tools at our disposal in terms of we could have a school pantry, neighborhood brick and mortar pantry, pantry on the go, which is a same day distribution event. We also have our mobile market is a great tool for where we don't have a host site available to do food distribution. And we can take our mobile market and do it ourselves and provide wraparound services that are much needed. So we use that map for those quantitative data points, and then we really get to know our communities. We get feedback from our communities to really understand where are those areas and where are those people that we really need to do more to be able to serve.
Neighbor voice is something we're very focused on, right? So ensure that, because by and large, we're agnostic to the solution, right? We think all our solutions are can be very effective. We just want to make sure we're deploying them in the right communities based on feedback and input we get from the work that's being done by regional program directors. So I think that increases our effectiveness overall. So we're not here just pushing, we know that's the right solution to the right community at the right time, using all those data points. Yeah.
Exactly. Yeah.
Anything else, Elise?
Yes, this one's for Jennifer. You spent quite a bit of time on the Eastern Shore, and we'd like to hear a little bit more about how you're addressing food insecurity, specifically on the shore.
So the Eastern Shore is very rural, very geographically spread out. And with that, unfortunately, there are areas of unmet need that it's really become challenging as to how our partners in our network are able to respond to that need. Fortunately, with the mobile market, we're able to actually take a tool in our arsenal of tools into a community of direct need where, as Emily stated, other organizations are not in a place to be able to meet that capacity. We're able to go into communities, we're able to learn the needs of those communities and develop relationships with other social service support. So not only are we taking food into a community, but now we're bringing other supports that they wouldn't otherwise have access to, which has been a tremendous opportunity for us on the Eastern Shore. And now as we're growing across the state, throughout the state.
I love the concept of our ability to bring other resources in these communities. I mean, we're there in an effort to feed people for today, but hopefully this is a real powerful solution here that can bring more services to these local communities because we're already in it. So.
Well, we also have a question for Nekeisia, and you had mentioned wraparound services earlier. How are we incorporating those into our work?
Asking Elise, we know first and foremost that it's going to take more than food to end hunger. We've done assessments a year prior to COVID to find out what are other issues that individuals, low income, marginalized communities are facing. So we know that beyond the food distribution that's addressing a right now need, that we really need to kind of assess to find out what we kind of look at as just day-to-day needs that our neighbors are experiencing. So what we've been able to do the beginning of this fiscal year, our SNAP team that provides SNAP application assistance for individuals who are food insecure, we've instilled an assessment tool to find out what are the barriers they may be having. So when you think of housing, when you think of utilities, transportation, childcare, that we're finding out what those needs are, and we're building a support through other partners in communities in which our neighbors live in to find out what resources they have available for it. So it's more than just here's food today, but what are those other needs that are keeping you from being self-sufficient? So we look at this model as implementing on our mobile market. So Jennifer and her team, with the integration of food and connecting with partners in those communities, they're able to, provide health screenings if needed. So with our healthcare partnerships, as we're beginning to build those out, that's meeting a need. So when we talk about how nutrition is impacting the health, so we're having those screenings made available to people who are at our pantry on the go activities. So we're doing more intentional focus around integrating, assessing what those needs are, building partnerships with entities where that's their specialty, and trying to connect those who are coming to our door for food, but to extend referrals and other resources to help them meet those needs on a day-to-day basis.
Thanks, Nekeisia. One question we have is about the arts. And we've really talked a lot about lifting up client voices and really hearing from our neighbors directly in terms of our services. How do we see a role for the arts in strengthening our programs in terms of spoken word or any type of poetry or things like that that could really lift up neighbor voices?
That's a good and unique question.
Yeah. We're a little
We're
stumped on that one. Yeah, we thought we've covered a lot of ground here.
I think as we began to build out our speakers bureau, when we really began to do our partner convenings, I think that's an opportunity where we're going into communities to find out what are your needs? How do you express those needs? We're not going to be prescriptive. We're going to just say, being open to how people want to express what their needs are. And that's a little different approach from us. I think for most nonprofits or even government, entities, they go into communities with the magic pill, if you will, but without taking that time to really find out what the needs of our partners are, as well as the neighbors in which we serve collectively. So I think that's an opportunity to expand and grow.
Yeah.
So we'll keep ourselves open to, again, however communities are wanting to express what their needs are, being at the table to create those co-authored solutions is going to be impactful. So we're not opposed to things that are out our ordinary, because it can create extraordinary opportunities for excelling and to really address this issue of hunger. So
yeah, I'm glad you went there with that. I mean, I was thinking about it from a different perspective, from just more of a marketing and PR perspective, right? How do we use the arts to kind of elevate the issue of food insecurity? And so maybe there's ways we could do that as well. Because I think, reaching different audiences to make folks aware of the fact that the issue is significant in our state, right? 1 out of every 3 Marylanders are suffering from food insecurity. And so how do we get more people to realize that that's the issue? And I think the pandemic really was an opportunity to elevate that, because as these images were piped into people's living rooms on national television, that clearly informed people of some of the challenges. But to make sure we keep that message out there, to find different mediums to do that. So I went a different place than you did, but I think both of them could work. Yeah. That's a great question. Thank you.
Absolutely.
A great answer. We have a question about the level of food insecurity Has it increased or decreased during the pandemic? Has your funding kept up with the increased demand?
You want to hit the level and then I'll hit the funding?
That sounds
How about
great.
that? All right.
Sure. Yes, unfortunately, the level of food insecurity has dramatically increased as a result of the pandemic, as can be expected. We saw, certain populations disproportionately impacted as well, by the pandemic, and we are paying closer attention to that. So it's not just geographic areas of need, but also populations of need, that may be in pockets that we hadn't, paid close enough attention to before. So we have a health crisis, and now we have a crisis of our economy with inflation and cost of fuel, and we're hearing a lot about the impact that that's having. So it is always difficult to get exactly real-time numbers of what food insecurity levels look like. So we rely on, the information that we get from our neighbors and from our partners, and the need and demand that we're seeing, to really inform that need. And we do know that the levels are, at really incredible levels that we haven't seen before.
Yeah, absolutely. And we've done our own perception surveys and things like that. Every data point seems to point to the same level of numbers. So we feel some level of confidence that the fact is it is higher. Funding is a good question. We were the beneficiaries of tremendous support during the peak of the pandemic, when the demand, and the issue was again elevated at levels that we had never seen before. And we were very fortunate to get tremendous amount of support. That's allowed us to buy all the food that we were talking about earlier, buying and providing it to our network at no cost. It allowed us to introduce new programs and solutions to the communities we serve. And so we had tremendous support. That support has carried over, because some of that food, some of those dollars came in significant volumes, more so than we could literally have the capacity to respond to during the course of the pandemic. But it's paying dividends for us today. And so as we talked about earlier, as you know, the cost of food has grown as much as it has, $17 million impact into purchased food. That funding that carried us through the pandemic is continuing to carry us through kind of, I'll say post-pandemic, even though it's not really post-pandemic, but dealing with this economic environment. So while the levels of financial support today are not what they were, we do have a bit of a backstop that's allowing us to continue to do the work we're doing. But that's only going to last so long, and it's going to be something that hopefully over time we'll continue to have the necessary resources for us to provide a highly nutritious food menu, to be culturally preferred, to focus on foods that are more dealing with health issues, as well as a programmatic response. We know we're going to need more support to do that, both public and private. But for the short term, we're very fortunate to be in a position to do what we need to do. So thank you.
And kind of playing off that, Carmen, as we look ahead, what are ways that people can stay engaged with the Maryland Food Bank to support our mission and this great work we have ahead of us?
Yeah, I mean, we're going to continue to work hard to find all sorts of ways for folks to be engaged. You can start with just volunteer opportunities alone, right? There's opportunities that folks could come in and donate their time to our mission. And we're trying to find creative ways to tap into people's their skills and other resources. So it's maybe go beyond sorting food to other needs we might have as an organization. We'll try to find ways to connect them with our partners, perhaps to provide them some level of volunteer support. We'll continue to try to communicate as much as we can. We're very focused on making sure all our stakeholders are informed, using forums like this to share activities going on in the organization, to hopefully make people aware of everything we're doing so that you can stay connected. So we'll continue to try to communicate with you as many ways as we possibly can. And then also just continue to ask your financial support to help us do what we need to do. And so I think that's a critical need for us, as we move forward, to ensure that we can continue to stay consistent. What we don't want to see is a level of support that we provided over the last 2 years, whether it's food, grants, sharing of best practices, to kind of go off a cliff. Obviously, we want to keep this momentum going. We think it's an important role for us to play. We think we've done a great job in supporting our partners and strengthening our partners, as well as bringing new partners on. And so we want to continue to provide that level of support, and financial support will hopefully allow us to do that. And we'll continue to try to find ways to engage our donors in that work.
Great, thanks, Carmen. And finally, just kind of a question about our recent changes in infrastructure at the food bank. And how do these impact the programs discussed? Just, I know we talked a little bit at the beginning of your new roles, but just how we've changed things, how is that going to really, I guess I would say, help streamline our programs and be more efficient and effective at the work that we do?
Well, I'll take that.
Okay.
Again, the integration, kind of stay focused on our food works coming into our programs team, that it's allowing us to leverage the knowledge base. It allow us to really maximize the work between the teams to service those who are in our training programs, as well as kind of build out a case management model that allows for a gateway through referrals, through people who are coming through our doors, either through our SNAP program, who's coming to our distribution events, to connect them with resources that are within their community or is on a statewide level. So I think with this merger, it's allowing us to be a more collective and have a greater impact on all those we're serving here in Maryland. But it also allows us to maximize our resources across the team. So kind of it's building a bridge to what has been some siloed organizations, parts of the departments and how they ran. So I think with this streamlined approach, it's going to allow us to really do more collectively and to broaden our reach to who we're serving, how we're servicing them in a way that's going to bring all partners together, whether it's our external strategic partners or even internal within our department. So once again, I'm excited about it's a lot of work. And, I'll be leaning very heavily on these two, Jennifer and Emily, to carry our programs through our food distribution models, while also really connecting our community impact team. We have a nutrition education director who's phenomenal at the work that they do. So how do we leverage those resources to support that work, to get our partners in the know of how to give clients choice, and how to give nudges on where foods are going to be healthier for them, while also letting them decide what's best for them and their families.
Yeah, I think that's exactly the right answer. And the only thing I would add to that is, I would say, I've been here almost 6 years now, and I think about when I first came on board, I felt like we were largely an operations-driven organization, right? And I think one of the shifts that we've made, one of the pivots we've made over the last 5 years, is to become more program-driven. I mean, program-driven from the standpoint of understanding the needs in our community in a deeper way, in a way we've never had before, and ensure that then as we distribute food into those communities, programs into those communities, they are, again, as we said earlier, the right programs, as opposed to kind of being more of a holistic state, like we're kind of spreading food out across the state, which was great work and how it was effective work. But I think, and we're not pulling back on this, everything we're talking about to the hunger hotspots doesn't mean we're not providing support to other communities. What we want to do is be very intentional and focused on the right program and the right community. And so I think this program, the changes we made within the programs department only makes us, the programs team only makes us more effective in our ability to do that, and ensuring that we're providing the right solution to the right community at the right time. Because otherwise, 5 years ago, without the purpose of data, without the regional program structure, I don't think we would have that kind of perspective, be able to make those kind of decisions from where we sit today. So I think the shifts that we're making are going to just make us more impactful as an organization.
Thank you. And just had some good feedback from one of our attendees about specific examples in specific communities. It'd be helpful to make some of this discussion more tangible. I know we talked a little bit about mobile markets and pantry on the go, but is there anything else that you want to just add in terms of some specific examples about some of the work that we're doing, maybe in some specific communities that can really kind of tie a bow around today's discussion?
Mobile market.
So, I mean, some of the things we can talk about, there's a couple different things. We have so many programs that offer support to the communities that we're serving. So mobile market during the height of the pandemic, obviously being able to be safe and responsive to the communities, we were able to use our backup box philosophy to still bring nutritious, shelf-stable foods and produce out to the communities. But it also gave us opportunity to expand in a way where we had areas like Carroll County, for example, or Charles County with our healthcare partnerships, that we needed an immediate response mechanism that our partners just didn't have the bandwidth to be able to respond to. And I think being able to leverage these different types of programs gives us opportunity to do that. So we talked about pantry on the go. on the same day distributions. We've talked about mobile market going into underserved, underrepresented communities, but we have our school pantry program that through the height of the pandemic morphed in a way that we weren't just focused on children in school, because we all knew children were not at school. So that turned into how are we going to serve the community? How are we going to serve their families in a much larger way? And our school pantry programs actually became pantry on the go programs or same day distribution outlets serving a greater community need. We have our federal assistance programs and our TFAP program. And with that, we're able to also support individuals that, as we all know, data tells us, we have this ALICE part of the population that's just above the federal poverty level, and they don't qualify for federal benefits. So we're able to service individuals in that way, which before we didn't know who that population was. So there's so many different opportunities, I think, in the work that we've done over the last few years. But what I would like to say is that during COVID, it gave us opportunity to really learn and be able to grow in a way that, as bad as COVID was, it did allow us to really reach beyond the work that we were doing in a way that we're maximizing so much more as we move forward. And Emily, I don't know if you want to add to that.
It's hard to add to that. That was a great answer. But yeah, I mean, I think that's exactly right. I mean, we have, in terms of specific examples, we have tailored solutions for each region and each county because they're so unique. So for example, the need in Baltimore City is very different than the need in Garrett County, but we have to address all of that need in different ways. So there are some types of solutions that would work better in a more rural community, in a community that has less access, consistent access to grocery stores, whereas you may have a more dense need that you would see in Baltimore City, where we have to figure out how to help our partners collaborate and work together and really identify what the needs within that community might be. You're exactly right. School pantry is, one type of solution in a community where the school might be the community hub for that area. Whereas in another area, I think of like Cecil County, we have, quite a bit of rural and spread out population, but then we do also have some dense areas there as well. So it's really relying on our partners in those communities and our neighbors in those communities to help us figure out what are those tailored solutions and how different they are. So, we have 22 counties that we serve, and each has a different story, and each community within those counties has a different story. So it's really learning and understanding those stories and figuring out where we play a role.
Yeah, the only thing I would add to that is look at FoodWorks, right?
Yeah.
We've always had a desire to expand the program. We're expanding our kitchen here in Halethorpe to be able to allow for more students, but we began to realize that we weren't reaching certain populations. So we opened up a site in the city focused on youth, 18 to 24-year-olds to join that program. And then we had some feedback from the Eastern Shore about the need for skilled culinary experts into that what's become a year-round hospitality industry. And so starting that program on the Eastern Shore, I guess, is in direct response to some of the need we heard there as well. So again, this is us trying to be as responsive as we can and provide a solution that's unique to that particular geography. And the regional approach allows us to identify those. Otherwise, some of that stuff would not have been, we wouldn't even have known. Yeah. Okay. I thank everybody for all the questions. I also want to thank my very distinguished panel here. Emily, Jennifer, Nekeisia, you have these lovely parting gifts that we want to make sure that as your compensation for your time this morning, you can keep those cups and enjoy future coffees with Carmen. Those of you who joined us today, I just hope you got some sense of the exciting things happening here at the food bank. And we love this opportunity to share information with you so that you can stay connected and know that your support is really fueling our vision and helping to change the lives of Marylanders in our state each and every day. So I just, again, want to extend my personal thanks as well, the thanks of my colleagues in the entire food bank for all you do, for your generous support. We talk about partnerships all the time. You heard it several times in this conversation alone, and those partnerships take many shapes and sizes, many forms. And the one we have with you as our donors are critically important, not only to our success today, but our ability to continue to stay strong and steady for the challenge of the future. So I hope, as you saw today, we have an incredibly strong team. We have highly effective program solutions. We have a high impact strategy team and plan. And we're working every day to fuel Maryland's recovery and help more Marylanders become food secure for good. And we can't do that without you. So thank you very much for your time today and for your generous support.